A Healthy Start for a Healthy Life, a strategy for child and adolescent health and well-being in the WHO region 2026-2030. So this agenda item 8 will now be discussed. You should see the relevant documents for this agenda item on the screen. And I would like, without further notice, immediately giving the floor to the regional director to introduce this item, and that we can then discuss after the intervention of the regional director. So, dear Hans, whenever you're ready, the floor is yours.
Thank you very much, dear Chair, and I would also like to express my sincere appreciation to the delegation of Slovenia for the very, very tasty and healthy breakfast, exactly what we needed to keep our level of energy and enthusiasm for day 3. Thank you so much and congratulations. Honorable delegates, colleagues and partners, it's my great pleasure to introduce the presentation of this very important technical item on the new strategy for child and adolescent health and well-being in the WHO European region. Living and aging in good physical and mental health is a core priority of the European Programme of Work number 2. And this journey begins not in adulthood, but from the very start of life. A healthy start for a healthy life. The title of the strategy was suggested and chosen by you, the Member States. The Foundations for Healthy Aging, or led in childhood and adolescence. Our region has made significant progress over the past decades. Yet today we face a sobering reality. Some health outcomes for children and adolescents are stagnating and in some cases even reversing. For the first time in 2 decades, neonatal mortality rates are rising in 6 countries and stagnating in 3 others across our region. Each preventable death is a profound personal tragedy and a societal failure. The inequities are striking. Neonatal mortality in the highest mortality country is 28 times higher than in the lowest. Meanwhile, 9 million forcibly displaced children in our region are living with the trauma and disruption caused by conflict, persecution, disasters and climate crisis. Numbers that continue to grow. Mental health concerns in children and adolescents increased significantly since the COVID-19 pandemic. These early onset conditions shape life trajectories, often leading to poorer educational outcomes and higher unemployment in adulthood. And the digital environment is compounding these risks. Problematic social media use has increased from 7 to 11% in just 4 years, contributing to rising mental health issues, sleep disturbances, and reduced academic performance. We are also witnessing a steady rise in overweight and obesity among school-aged children. This trend has serious implications for both physical and mental health, and if left unaddressed, is projected to cost our region $800 million annually by 2035. These challenges do not exist in isolation. They are all deeply interconnected, shaped by social, commercial, and environmental determinants, and demand coordinated cross-sectoral action. No single intervention will suffice. We need a comprehensive, equity-driven approach that addresses the full spectrum of influences on children's health and well-being. A renewed impetus for child and adolescent health is essential, not only to reverse these trends, but to tackle the contemporary and emerging challenges that threaten the well-being of future generations. This call to action was clearly articulated in the joint letter we published earlier this year with the UNICEF Regional Director, Regina De Dominicis, and thank you, Regina, for joining us today. And this was published in The Lancet, underscoring our shared commitment to this agenda. Over the past 12 months, we've led an intensive and inclusive consultation process, including member state consultations, the establishment of an advisory board, engagement with non-state actors, and meaningful participation of adolescents. This strategy is the result of a truly joint process with UNICEF, of which I am very proud and very grateful. And I want to express my sincere appreciation for this collaboration and leadership. A great example of the spirit of partnership and co-creation that defines the UN80 approach. And Regina and me early this morning were discussing already how to concretize these alignments. We're proud to present the strategy today, and we believe it will be a key enabler for countries to advance in strengthening child and adolescent health and well-being in the region. Reliable data will be essential to guide the implementation. The health behavior in school-aged children survey remains a cornerstone for monitoring adolescent health behavior and outcomes. Continued country support is vital to ensure data collection and data availability through the survey to ensure evidence-based actions. Thank you, Executive President.
Thank you very much, Regional Director. Thank you, Hans. I would like to give the floor now to Ms. Regina De Dominicis, the UNICEF Regional Director for Europe and Central Asia. Please, you have the floor.
Thank you, Mr. President. Excellencies, distinguished guests and partners and friends, let me begin also by thanking my friend, Dr. Hans Kluge, and the WHO Regional Office team for bringing us together, and also for the close partnership that has guided the development of this strategy. We meet at a turning point, and Hans has described it very well. In many ways, the health of children tells the story of how well or not well our society are doing. And right now, this story is mixed. Immunization rates, as Hans has mentioned, are falling in several countries. Obesity amongst school-age children is rising fast, and more teenagers are struggling with anxiety, depression, and self-harm. Newborn deaths are still too high, especially amongst the most vulnerable groups. These are warning signs, and they tell us that systems that were designed a generation ago are not keeping with the pace of the needs and the new realities that children are facing today. In short, we do see that needs are growing faster than our responses. At the same time, we know the constraints. We know that budgets are tight, that health workers are stretched thin, that geopolitical tensions are reshaping priorities. But even in this environment, the choices we make today will determine whether millions of children will grow up healthy and hopeful or will be left behind. So what can we do? Funding matters, yes, and so does how we use it. And this strategy brings attention on how we need to use it and how we need to focus. Some of the biggest gain come from simple things that just simply we can do better, and we can do better together. A home visit that helps new parents care for their baby timely, a school that acts as a health promotion space, a digital tool that reminds families of upcoming vaccination. Small changes, but when done well, they can bring huge impact. And many of you are already doing that, and we are really proud that in many cases we're partnering together to do that in a different scale or with a different acceleration. That is the thinking behind this new regional strategy built through collaboration, led by member states, by all of you, guided by WHO and UNICEF, and enriched by the insight of academia, of professional bodies, of non-state actors, and, if I may, most importantly, by young people themselves. More than 3,000 adolescents took part in this consultation, and I think Hans recalled how they challenged us, but also how they help us to make this strategy more grounded in their own reality. Our partnership with WHO has never been stronger. It is more structured, it is more strategic, it is more focused in results than ever before. And I would like to thank you, Hans, for the leadership on this. This very morning, as Hans mentioned, we have discussed how to start supporting the implementation of this strategy. As UNICEF, we are trying to budget around 22 country offices, approximately $250 million until 2030. Despite the difficulties in the financial environment, we do strongly believe that we need to back up the implementation and the acceleration of this action. And you are now exploring a joint WHO-UNICEF initiative, for instance, on mental health, to combine our technical expertise and the country reach. This collaboration with WHO shows how efficiency and ambition can go hand in hand, and actually shows how UN80 is already in action. We are also partnering with the European Union and the private sector to scale up solutions and accelerate innovation in areas like digital health and data system, making sure that progress reaches every child and everywhere. We are confident and we are hopeful that they will continue to stand with us also in the implementation of these important strategies. As we look ahead, let us remember that what these strategies truly represent is not simply a plan. For us, it's a commitment to give every child and every adolescent the chance to grow up healthy, confident, and safe. Please continue to count on UNICEF as we continue to count on all of you. Thank you.
Thank you very much. And throughout the development of the strategy for child and adolescent health and well-being, adolescents have been engaged, ensuring their voices and perspectives were shaping the process. This collaboration will, of course, continue as we move into implementation. The video you are about to see now was also created by adolescents themselves. It began with an online consultation, followed by a focused discussion with volunteers to frame the key messages. Two of these young volunteers then presented the main conclusion in their own words, bringing ownership to this message.
Greetings from Moldova. We are Valeria and Mihaela, and we are volunteers from Youth Clinic, Republic of Moldova. By analyzing our problems and those of our peers, we have identified 3 main actions to reduce those issues, and we appeal to your support so that they can be implemented in every country.
First, by ensuring every child and adolescent have access to free health services. One example of these services would be the Youth Clinic from the Republic of Moldova, where we give free access to contraceptives to adolescents and many other services. Second, by ensuring the collaboration between the health and educational systems, so every child and adolescents have access to health lessons, including sexual education and practical lesson on first aid. And lastly, by ensuring that every child and adolescent is included when talking about their health, especially by creating platforms where they can express their needs more directly and easily.
We adolescents are get ready to implement of European strategy on the health of children and adolescents. By sharing our opinions and needs regarding to our own health, by engaging and promoting the strategy document and directly the activities proposed by the strategy. We wish you success and hope that our voices will be heard.
Thank you for this truly inspiring message. And I would like to pass the floor now to Dr. Natasha Azzopardi-Muscat, the Director of Health Systems Division, who will present us the key elements of this strategy now. Natasha, the floor is yours.
Thank you, Mr. Chair. Good morning, distinguished delegates. And can we go straight away to the first slide? You have heard both our regional director, Dr. Hans Kluge, and the regional director for UNICEF, Regina de Domenicis, explaining where we are. A year ago, we had a side event at the regional committee where we presented where the region is. And the fact sheets are available online, and you can see, as has been outlined, that there is some good news. For example, a number of countries have made progress in extending HPV vaccination coverage, but there is also bad news. There are still too many unnecessary hospitalizations. The poor mental health and well-being has been alluded to already, And I would like also to remind everyone that 1 in 4 children lives in a household where they witness violence, linking back also to the round table on day 1. So moving to the next slide, you gave us a clear mandate to work on a renewed child and adolescent health strategy. So we have worked with what we have, our basics, data. But even this we cannot take for granted. As we start now to ask you to work with us on the next Health Behavior in School Children survey, I appeal to all of you to ensure the necessary funding for these surveys to continue, because we cannot be complacent when it comes to the measurement of the health and well-being of children and adolescents in Europe. Through routine data collections and surveys, which many of the countries participate in, we were able to present a series of country profiles. Because at the end of the day, progress means that every country identifies the areas that it feels it needs to work on and commits to making an improvement. And through the monitoring that we put in place using existing data sets and an ad hoc survey which will be carried out in full consultation with the technical focal points at 2 points, midterm and end of term, together we will be able to see where the region has made progress, but you also will be able to see where each country has made progress. Coming to the next slide, which is how we are going to work. Yesterday evening, you adopted the second European Programme of Work. And although you see me sitting before you here with my colleagues at the back of the room, Kira, who is now the Regional Technical Officer for Healthy Aging and Healthy Settings, and Sophie, who has been working very closely with your technical counterparts to bring this child and adolescent health strategy to life, this is actually a whole-of-house lift. And you will see that across the various areas, whether it's immunization, whether it's primary healthcare, whether it's mental health, digital health, or the NCD team, we will lift the implementation of this strategy together. Moving now to the next slide, you have heard our both RDs talking about the way in which we feel very proud that we have pulled this off very much together. And allow me here also to thank my counterpart, Gabriele, from UNICEF, who again has really been working hand in hand. We hope to show that this way of working can help us go further, help us go together. So let me just remind you, next slide, what we have in this strategy. It was, of course, not an easy task to incorporate all the many different asks that came from the member states, from the non-state actors, from the civil society. And here I would like to say that we are working very closely also with the European Academy of Pediatrics and the European Confederation of Primary Care Pediatricians, with whom we have signed memoranda of understanding as part of the new way of working. And of course, allow me also to thank our collaborating centers. Many countries have collaborating centers in this area who have really worked very, very closely with us. The end result is 4 pillars of action. The first pillar is really talking about investment in the early years. Both the RDs have alluded to this. Let me shine a spotlight on the fact that we still have catastrophic expenditure, financial hardship, that this tends to affect, for example, households where you have a single parent, and that we can plug many gaps still in the area of primary care. We should not leave this unnoticed. Secondly, when it comes to protecting our children and adolescents, we know that this is where we find consensus together, all of us, whether it's protecting them against the harm of tobacco, nicotine, unhealthy exposure to unhealthy foodstuffs, alcohol, and now increasingly the digital world, and how we help our children and adolescents to navigate this complexity, taking the benefits but keeping them safe from harm. When it comes to high quality care, we have developed, for example, mental health standards for the care of children and adolescents through our office in Greece, and we would like to work with you to implement these. There is still work to be done to reduce unnecessary antibiotic usage. And the fourth pillar, multi-sectoral engagement, and this is where our work with UNICEF comes in handy, because we need to work at local level with schools, with sports facilities, with the social sector. So the final slide just reminds you what you have in your package. The working document is the strategy with the actions, and I would like to assure you that there is also a table behind that that shows where WHO will lead, where UNICEF will lead, and where we really will lift together. The information document provides you with the background epidemiological situation. We, of course, invite you to positively consider the adoption of a decision document and to peruse your country profiles. And please reach out to us, because if a closed policy dialogue or an open discussion at country level using the country profile as a starting point is helpful, we would be very happy to support that initiative. Thank you very much.
Thank you very much, Natasha, and thank you also to the entire team. And also this shows a nice collaboration between different entities that we can follow the same goal. So with this, I would like to start the discussion now on agenda item 8, and I would like to open the floor. And as I see, we have a few group statements, so we will start with these and then come to the different member states. Can we get started with Estonia, who would be likely to speak on the behalf of the Nordic Baltic countries, followed then by Israel, who will speak on behalf of the Southeastern Europe Health Network. Estonia, you have the floor.
Chair, Regional Director, Excellencies. I have the honor to make this statement on behalf of Estonia, Denmark, Finland, Iceland, Latvia, Lithuania, Norway, and Sweden. We commend a regional office in collaboration with UNICEF for developing this comprehensive and timely strategy. We believe this is an important step toward a future where every child and adolescent can fully enjoy the right to the highest attainable standard of health and well-being. They have the right to grow up in a supportive environment that help them thrive in a rapidly changing world. This strategy is a good tool to help member states fulfill their commitments under the UN Convention on the Rights of the Child and the Sustainable Development Goals. We would like to draw particular attention to the part of the strategy addressing sexual and reproductive health and rights. Our countries remain strong supporters of SRHR, promoting gender equality and ensuring universal access to SRHR services and timely comprehensive sexual education are essential. It is vital that our young people and adolescents can make autonomous decisions about their own bodies, sexuality, and reproductive health. Upholding these rights supports individual and collective well-being, strengthens communities, and lays the foundation of sustainable social and economic development. Comprehensive sexual and reproductive health services are essential for achieving the SDGs. These services strengthen population health and lower maternal and child mortality. They provide young people with the information and support needed to make informed decisions about their health and future. We cannot ignore the growing impact of digital media on young people's health and well-being. Problematic use of social media is rising, with negative effects on mental health, sleep, and academic performance. It is crucial to develop young people's digital competence and to create a safer, age-appropriate digital environment that supports healthy development and protects minors from harmful content and online risks. We would also like to highlight the importance of addressing the harmful effects of commercial goods and services, and we fully endorse the emphasis on protecting children and adolescents against harmful effects of commercial goods. We strongly support the focus on reducing consumption of unhealthy foods, sugar-sweetened beverages, tobacco, nicotine products, and alcohol. Early years of life are critical for establishing lifelong healthy behaviors. To ensure a healthier future with fewer non-communicable diseases, we must act early and focus on prevention from childhood onwards. We believe that the WHO's best buys provide an excellent framework for protecting young people from industry influence and for promoting healthier choices across the population. We would particularly like to highlight the important role of the EVID Action Project. It has been instrumental for many countries in strengthening evidence-based alcohol policies. Continuing this initiative is crucial and would align well with the actions of WHO Europe and UNICEF in the strategy. Together, we can ensure that every child and adolescent in our region grows up in an environment that supports their health, well-being, and full potential. Thank you.
Thank you very much, Estonia. I would like to give the floor to Israel for their group statement on behalf of the Southeastern Europe Health Network, followed by Denmark. Israel, you have the floor.
Thank you, Chair, Your Excellencies, Regional Director, ladies and gentlemen. It is an honor to deliver this statement on behalf of the member states of the Southeastern Europe Health Network, SEAN. We commend the WHO Regional Office for Europe and UNICEF for developing this comprehensive and forward-looking strategy that places children and adolescents at the center of resilient, equitable, and future-oriented health systems. Across the CE region, countries are implementing actions that align with the 5 strategic priorities of the proposed framework: investing in children and adolescent well-being, ensuring equitable and quality care, regulating for protection, fostering multi-sectoral action, and strengthening monitoring for accountability. Earlier this year, SEAN, in collaboration with WHO Europe and the Regional Health Development Center on Sexual and Reproductive Health, hosted by Romania, convened a regional consultation on maternal and newborn health. The meeting united ministries of health, experts, and partners from SEAN member states to review progress and set a shared direction for improving maternal, newborn, and child health outcomes. Key priorities identified by SEAN countries include strengthening maternal and child health systems and workforce capacities, including midwifery and community-based care, advancing digital tools and interoperable data systems for better surveillance and service delivery, promoting perinatal and early childhood interventions, breastfeeding, and adolescent health education, addressing cross-border preparedness and equity in access to services. The SEAN region remains committed to ensuring that every child is given a healthy start and that adolescents are supported to thrive. To achieve this, stronger partnerships, predictable investment, and continuous regional cooperation are essential. SEAN reaffirms its readiness to collaborate closely with WHO Europe, UNICEF, and all partners to operationalize the new strategy, linking SEAN member states' priorities to regional collaboration for sustained impact and healthier futures for the next generation. Thank you.
Thank you very much, Israel. I'd like to give the floor to Denmark, followed by Finland.
Honorable Chair, distinguished Regional Director, Excellencies, dear colleagues. I have the honor of speaking on behalf of the European Union and its 27 member states. Today, our region faces persistent and emerging child and adolescent health challenges, such as stagnating child and adolescent mortality, slow progress in reducing adolescent birth rates, declining immunization coverage, increased developmental risk, high prevalence of overweight and obesity, harmful substance use, and increasing mental health issues among young people. These challenges can notably be addressed by improving quality and access to child and adolescent-friendly healthcare, supporting breastfeeding and healthy diets, promoting physical activity, and implementing effective tobacco, nicotine, and alcohol control policies. The EU is convinced that investing in the health and well-being of children and adolescents is not only essential to fulfill their rights, but also one of the most effective ways to build resilient, equitable, and prosperous societies. Early, sustained, and evidence-based actions prevent long-term health burdens, improve educational outcomes, safeguard human capital, and reduce inequalities caused or affected by social determinants. Early behavioral approaches are key in preventing chronic non-communicable diseases later in life. The EU and its member states highlight 4 strategic priorities. investing strategically in the health and well-being of children and adolescents for positive and lasting outcomes, with a special focus on the most vulnerable to poor mental and physical health and well-being due to their socioeconomic and situational circumstances. Strengthening health systems by providing accessible, comprehensive, and equitable high-quality healthcare and preventative service from the prenatal and neonatal period to adolescence. Third, considering regulations as appropriate and in line with national context to protect children and adolescents from the harmful effects of commercial goods and services, and counter disinformation through access to comprehensive and validated scientific information, including on sexual and reproductive health and vaccine safety. Fostering multi-sectorial mobilization through health-promoting schools and educational settings, parental and caregiver support, fostering inclusive communities, social protection, and healthy environments, including healthy food environments and safe spaces for sport and leisure to promote physical activity and increase inclusion. WHO Europe plays a central role in supporting, guiding, and coordinating these efforts. We welcome the new strategy for child and adolescent health and well-being 2026-2030, developed jointly with UNICEF, and commend the regional office for driving this agenda. Implementation of this strategy is in line with EPW2 and will ensure consistency and maximize impact. We commend UNICEF and WHO for having developed a joint strategy and recognize this as a concrete step towards more coherent engagement across the UN system. In this spirit, we emphasize the importance of partnering with UNFPA to further strengthen the coherence and impact of UN support for child and adolescent health. As accountability is key, the EU and its member states strongly support a robust monitoring framework to be agreed by member states, ensuring transparency in order to assess the ongoing effectiveness of the implemented measures. The EU and its member states stand ready to work with all partners, including with the participation of children and young people themselves, and draw on this strategy to deliver tangible results for healthier generations and a stronger future for our region. Thank you.
Thank you very much, Denmark. I'd like to give the floor to Finland, followed by France.
Thank you, Chair. Finland aligns itself with the statement delivered by Denmark on the behalf of the EU and a Nordic Baltic statement delivered by Estonia. We welcome the strategy for the child and adolescent health and well-being. It's critically important in the context of the economic instability and climate change and declining mental health across our region. Finland supports horizontal multisectoral approaches to create healthy daily environments for children and young people. Collaboration must include health as well as education, housing, sexual and reproductive rights, and social security. We recognize that the success of this strategy hinges on meaningful participation of children and adolescents in everything. We welcome the vision that places children and adolescents as active agents and partners in all policy development and service design that affects their lives. Thank you.
Thank you very much, Finland. I'd like to give the floor to France, who will most likely speak in French, and then move on to Germany, who may speak in German even. France, you have the floor.
Merci beaucoup. Thank you very much, Regional Director Hans. Colleagues, France aligns itself with the statement made by the Danish presidency on behalf of the European Union and would like to hail the work done by the regional office on this subject. Fair access to neonatal child and adolescent health is an essential in implementing human rights. Notable progress has been made in recent years in the region in terms of child health, but there are still challenges. There are inequalities in access to care and perinatal mortality rates that still challenge us. France prioritises this subject in its public policies, concentrating on three areas. The first is offering care that is specific to the needs of children and adolescents. Our priority is to respond to the specific needs of children and adolescents. by paying particular attention to the mental health of these young people. We've seen an increase in anxiety, depression, digital addiction, and given that, France is concentrating on prevention and working through the issues around children using screens and trying to make proper digital education. We also want to make sure that we have coordinated multi-sectoral care for children and adolescents. France, in particular, is prioritising the 1,000 first days of life, which is really a key period for the physical, cognitive and emotional development of children, where they require a multidisciplinary approach. Thirdly, we wish to strengthen strategic investment in child health and adolescent health. France wants to see strengthened prevention from the first days of life by working in a multi-sectoral way and by reprioritising the health in schools programme with the relevant ministries at local level. Finally, France restates its commitment for universal access to sexual and reproductive health for adolescents and for young women. This access is a fundamental right and a sine qua non for sustainable development. France fully supports the actions of the WHO, coordinated with those of UNICEF and of its regional office for Europe in this area, and will continue to play an active role, in particular through initiatives around health and sexual and reproductive rights. Thank you.
I would like to give the floor to Germany, followed by Hungary.
Thank you, Chair. Germany aligns itself with the statement delivered by Denmark on behalf of the European Union and its member states. Germany welcomes the strategy for child and adolescent health and well-being. We strongly support its vision of enabling every child and adolescent in the European region to realize their right to physical, mental, and social well-being. We appreciate the participatory approach taken in developing this strategy, including consultations with young people themselves. We encourage member states to maintain this engagement during implementation. For the future, we would, however, appreciate a more focused and stringent approach while developing strategies, in order to have sufficient time for the required coordination processes within member states to ensure the highest quality feedback. Children and adolescents are not small adults, and we appreciate that the strategy rightly emphasizes their distinct needs that require tailored multi-sectoral approaches. Investing in their health and well-being is not only a matter of equity, but also an investment in resilient societies. Young people today face increasing pressures linked to digitalization and substance abuse, as mentioned in the draft, but also social inequality, climate anxiety, and global instability. Addressing these issues requires responsive, youth-centered services and access to quality healthcare. Therefore, Germany particularly welcomes that the strategy takes a broad approach covering important topics such as mental health, screen time and social media use, children's weight, alcohol, tobacco, and nicotine use, all significant threats we need to tackle. We also welcome the fact that the strategy explicitly mentions the issues of sexual and reproductive health care as part of comprehensive and age-appropriate health services. Ensuring access to this information and care empowers young people to make informed decisions about their bodies and their lives, supports gender equality, and helps prevent avoidable health risks. Integrating these services is consistent with the 2023 UN Political Declaration on Universal Health Coverage and remains essential to acknowledging the lived realities of young people across our region. Finally, we wish to underline that the value of this strategy will depend on the solid financial coverage and its translation into concrete national action. The strength of WHO lies not in the number of strategies adopted, but in the meaningful improvements achieved in people's lives through their implementation. Germany stands ready to contribute together with partners to this shared effort to ensure that the commitments made here result in healthier realities for children and adolescents throughout the European region. We hope all of you are doing the same. I thank you.
Thank you very much, Germany. I'd like to give the floor to Hungary, followed by Ireland.
Honourable Chair, distinguished Regional Director, dear colleagues. Hungary aligns itself with the statement delivered by Denmark on behalf of the EU and its 27 member states. Ensuring a healthy start for every child is not only a moral imperative, but also a strategic investment in Europe's future. The new WHO UNICEF strategy for child and adolescent health and well-being offers a comprehensive framework to translate this vision into action. Hungary fully supports the strategy's 5 priority areas. First, we emphasize strategic investment in early childhood and adolescence. In Hungary, public spending on health represents nearly 10% of total public expenditure, yet we recognize the need to further strengthen preventive services, particularly in primary prevention and health promotion, as well as services supporting mental health and digital well-being. Second, equitable and high-quality healthcare remains essential. Our national health visitor system, unique in Europe, ensures a lifelong continuum of maternal, child and adolescent care, linking health, education, social and community services. We are committed to integrating WHO standards for child and adolescent mental health, maintaining our strong national immunization program with coverage rates consistently above 99%, and further expanding national breastfeeding initiatives. Third, protection from commercial harm must be a regional priority. Hungary supports joint actions against the commercial determinants of health. In this respect, we support stronger regulation of harmful marketing policies targeting children, especially digital advertising of foodstuffs high in fat, salt and sugar, as well as alcohol and tobacco, and advocate for evidence-based taxation policies such as the Hungarian public health product tax introduced in 2011. Fourth, multi-sectoral collaboration is key. Hungary's health-promoting school network and Safe Places Thriving Children program exemplify cooperation between education, social and health sectors to build trauma-informed, inclusive environments. Finally, monitoring and accountability are also crucial to achieve progress. We support the creation of unified regional dashboards and national data systems to better capture indicators of physical and mental well-being, particularly among vulnerable groups. In conclusion, Hungary stands ready to contribute to a Europe where every child can grow, learn and thrive, protected, supported and empowered for a healthy life. Thank you.
Thank you very much, Hungary. Let's move to Ireland, followed by Italy.
Honourable Chair, Distinguished Regional Director and dear colleagues, Ireland aligns itself with the statement delivered by Denmark on behalf of the European Union, and we welcome this landmark strategy for child and adolescent health and well-being. We thank our WHO Regional Office and UNICEF for their work in bringing this strategy before us today. These are challenging times for the health and well-being of our young people. As outlined in the strategy, we are witnessing the stagnation or even deterioration of outcomes across a range of health indicators. Action is needed to reverse these trends and enable all children and adolescents to realise their full potential. Ireland welcomes the vision and the 5 priority action areas described in the strategy. Evidence-informed early interventions are key if we are to improve the long-term health, well-being and socio-economic outcomes. Our children and adolescents have a right to physical, mental and social health and well-being. They also have a right to be heard and engaged in decisions that affect their health and well-being. Ireland has the youngest population in the EU, with a quarter of our population younger than 19 years old. Our Youth Advisory Group on Child Poverty and Wellbeing have sharpened our focus with their recent powerful message, "We are not just the future, we're here now." Ireland's policies relating to children and adolescents, which have developed with active youth participation, offer a strong life course and cross-governmental approach to improving child and adolescent health and wellbeing. Ireland has invested significantly in our child and adolescent health services, with extensions of free primary care services and the construction of a new national children's hospital. This hospital will be a child and family-centred world-class hospital and represents the largest capital investment in the Irish healthcare system. Many of the health challenges faced in Ireland are shared internationally. These include child poverty, youth mental health, falling vaccination rates, and obesity. Ireland acknowledges the impact of social and commercial determinants of health on our young people, and we very much welcome the focus of the strategy on these issues. Our children and adolescents deserve accountability, and we look forward to collaborating with the WHO and other partners to develop a robust monitoring framework. This work will be supported by an enhanced focus on developing digital healthcare in Ireland. We look forward to harnessing the potential offered by the strategy and working towards the improved health and well-being of our young population. Thank you.
Thank you very much, Ireland. And let's give the floor to Italy, followed by Lithuania.
Thank you, Chair, distinguished Regional Director, Excellencies, dear colleagues. Italy aligns itself with its statement delivered on behalf of the EU and its member states. We would like to thank the Regional Office for Europe and UNICEF for developing the new strategy for child and adolescent health and well-being in the European region, and for the consultative process with member states, which supported its elaboration. We appreciate in particular the attention given to the mental health of children and adolescents in the strategy. Over the last 15 years, and particularly in the post-pandemic era, Italy witnesses a constant increase in access to neuropsychiatry services by children and adolescents, and in a progressive increase in complexity of clinical pictures and in access to acute care. References in the strategy, on one side, to the promotion of well-being and social connection to children and adolescents, including the awareness of social media, and on the other side, to the implementation of quality child and adolescent mental health care services, including the delicate transition of young patients to adult health services, are therefore welcome. Italy equally welcomes the support offered through the strategy in monitoring progress at national level to orient the implementation and accountability of programs, policies and innovation to the benefit of our children and adolescents and for the future generation. Thank you.
Thank you very much, Italy. I'd like to give the word to Lithuania, followed by Malta.
Thank you, Chair. Distinguished delegates, Lithuania fully aligns itself with a statement made by Denmark on behalf of the EU and Estonia on behalf of the Nordic Baltic countries. I am honored to address you all as the EU delegate of Lithuania. Lithuania fully supports the proposed strategy, A Healthy Start for a Healthy Life, and welcomes its comprehensive and forward-looking approach for improving child and adolescent health across our region. We commend the WHO Regional Office for Europe and UNICEF for developing a strategy that recognizes the interconnectedness of physical, mental, and social well-being, and the importance of early, equitable, and sustained investment in our youngest generations. In Lithuania, we have made strong progress in strengthening primary healthcare, expanding access to vaccination, and addressing mental health challenges among youth. However, we also recognize persistent inequities, the rise in non-communicable diseases, and the growing influence of digital environments on young people's well-being. The strategy provides the right framework to address these evolving challenges through better data, multi-sectoral cooperation, and stronger regulation of harmful commercial influences. We particularly welcome the strategy's focus on mental health, promoting schools, and empowering adolescents as partners in shaping the services that affect them. Lithuania remains committed to aligning national efforts with its regional vision, investing in prevention, education, and community resilience. We call on all member states to work together to ensure that every child in our region, regardless of their background, can thrive in safe, nurturing, and healthy environments. A healthy start truly is the foundation for a healthy and prosperous Europe. Thank you.
Thank you, Lithuania. Malta will be next, followed by Poland.
Malta fully aligns itself with the statement made by the Presidency on behalf of the EU and its member states. It also welcomes the proposed draft strategy and fully supports its implementation across the region. We recognize the importance of giving every child and young person the best possible start in life, as this is essential for improved health and well-being throughout the life course and contributes to sustainable health systems. We endorse the 5 strategic priorities outlined in the strategy. These align closely with Malta's national health agenda and support our efforts to deliver sustainable, personalized, high quality, and safe healthcare services that address the needs of children and young people in Malta. Malta proposes greater advocacy for cross-border regulation and cooperation on issues that impact the health and well-being of children and young people across Europe. These include the marketing of unhealthy food and beverage, regulation of tobacco and related products, drug addiction, alcohol use, social media, digital safety, and cross-border environmental challenges. Strengthened international and regional collaboration in these areas can significantly improve the effectiveness and sustainability of national interventions and ensure equitable, high-quality care across countries. We look forward to continued engagement in shaping and implementing this important strategy and reaffirm our commitment to working with WHO and other member states towards ensuring a healthy start to life for every child and young person in the region. Thank you.
Thank you very much, Malta. Poland, you have the floor, followed by Portugal.
Thank you. Honorable Chair, distinguished delegates, Poland aligned itself with the statement made on behalf of EU and Member States. Poland also expresses its firm and unwavering support for the WHO's new strategy regarding child and adolescent health and well-being. Poland strongly aligned itself with the principles and objectives outlined in this strategy, recognizing that the health and well-being of children and adolescents are not only foundational to individual development, but also essential to the long-term resilience and prosperity of our societies. We commend the WHO for adopting a life course approach, one which acknowledges the profound importance of investing in health from the earliest stages of life. We especially welcome the strategy's emphasis on equity, inclusion, and the active participation of children and young people in shaping the policies that directly affect them. Poland believes that every child, regardless of background or circumstance, has the right to grow up in an environment that nurtures physical health, emotional well-being, and the full realization of their potential. We also recognize that challenges such as mental health, digital exposure, and socioeconomic disparities require a coordinated, multi-sectoral response. As such, we are committed to strengthening our national system in alignment with WHO guidelines and to sharing our experience, resources, and innovations in partnership with fellow member states. As mental health of children and adolescents in the digital age was one of the priorities of the Polish presidency in the EU Council in the first half of 2025, we had the honor to host the side event on the margins of 78 WHA this year, entitled Mental Health of Children and Youth in Digital World, where we could listen to the first-hand experience from our youth representatives. Poland stands ready to actively contribute to the implementation, monitoring, and evaluation of this strategy at both regional and global levels. We firmly believe that by working together, we could build a healthier, more inclusive, and more sustainable future for our children and adolescents in Europe and around the world. Thank you.
Thank you very much, Poland. Let's move to Portugal, followed by the Russian Federation.
Thank you, Mr. President, Mr. Regional Director, dear colleagues. Portugal aligns itself with the statement delivered by Denmark on behalf of the European Union and its member states. Portugal reaffirms its commitment to ensuring that every child and adolescent lives, grows, and learns in environments that promote health, equity, and well-being. The new Child and Adolescent Health and Wellbeing Strategy further strengthens the country's alignment with the vision of the World Health Organization, recognizing that a healthy start in life forms the foundation for resilient individuals, cohesive communities, and sustainable national development. Building on national health priorities, the strategy reinforces the principle of investing in the health and well-being of children and adolescents for long-term benefits. Guided by the duty of care, protection, and the assurance of equitable access to quality services, Portugal remains committed to delivering person-centered care that responds to physical, mental, and social needs. We also recognize the importance of regulating against commercial harm and of further strengthening policies that safeguard children and adolescents from unhealthy and unequitable environments. Children are frequently targeted by food marketing and advertising strategies, and numerous studies have demonstrated that such advertising directly influences their preferences and eating habits. Since April 2019, Portugal has enforced legislation that places restrictions on food advertising directed at children under 16 years of age, representing a key step in reducing exposure to products detrimental to health. Through evidence-based action and the continuous updating of the National Child and Adolescent Health Programme, Portugal is committed to translating this regional strategy into concrete results. Our goal is to ensure that every child and adolescent can reach their full potential and contribute to a healthier, fairer and more sustainable future. Thank you.
Thank you, Portugal. Let's move on to the Russian Federation, followed by Slovenia.
Уважаемый председатель.
Chair, colleagues, we would like to thank the Secretariat for preparing the draft strategy and for the transparent process of developing it. We would like to note the difficulties that Russian experts faced in the consultation steps as a result of limited access to the online platform. Preserving children's health has always been a priority in the Russian Federation. Children require particular protection concerning their health and must be a priority in providing medical health. We have measures to improve access for children to medical health within the medical health system, including using modern technologies. The result of genetic diseases has led to the introduction of screening before birth to ensure that newborns can be provided with adequate treatment. Over 23 million children have been treated as a result of genetic diseases. There are many children who are under observation and receive support from the state fund. We also aim to improve the healthy lifestyle and to ensure that medical assessments can take place in schools as well. Concerning further obligations, we have both bilateral and multilateral cooperation with WHO. We need to see this as a part of a holistic approach to treating children's health. This is one link in prevention and ensuring we identify health risks to health. The terminology around sexual health is something that we do not agree with, but we support the rest of the document. Thank you.
Thank you very much, Russian Federation. I'd like to give the floor to Slovenia, followed by Spain.
Honourable Chair, distinguished delegates, I am honoured to give this statement as the Slovenian Youth Delegate. Slovenia strongly supports the A Healthy Start for a Healthy Life strategy and would like to convey our gratitude to the WHO, Euro staff and UNICEF experts with whom we cooperated in preparing the strategy. Highlighting 11 key areas for action and development for improving the health and well-being of children and adolescents, this document takes a modern and responsive approach to public health challenges faced by our youth. With clear outlines and guidance for how and where to act in countries of the WHO European region, the strategy provides support for planning and implementation of strategic and systematic measures. We would especially highlight Slovenia's work in the development of the ZDAI program for children and adolescents with the establishment of the health promotion centers and the provision of a multidisciplinary approach to the prevention and treatment of obesity and reduced physical fitness, as well as the establishment of a network of child and adolescent mental health centers and the remarkable progress made in this area. Slovenia has shown strong leadership and active involvement in European projects that focus on improving the health of children and young people, not only through small local initiatives, but also through broad population-wide programs. Working together across sectors, especially between health and education, has long been one of Slovenia's key strengths. Youth NGOs have also played a crucial role in this process, developing programs that promote health through peer-to-peer learning. In doing so, they empower and inspire other young people to make healthier choices and to take a more active role in shaping policies through consultations with decision makers. Slovenia is already providing funding for such projects and is developing mechanisms for youth participation. This approach strengthens trust between young people and institutions, ensures that policies reflect their realities, and creates a generation of young citizens who are both informed and engaged. By already advancing the elements of the A Healthy Start for a Healthy Life strategy, Slovenia is demonstrating a practical model for how member states can translate the strategy into action. We hope our example will inspire other member states to adopt similar commitments. In doing so, we will together contribute to building a healthier, more resilient society where every child gets a healthy start and every young person is equipped to lead a healthy life. Thank you.
Thank you, Slovenia. Let's move on to Spain, followed by Switzerland.
Thank you, Chair. Dear colleagues, Spain aligns itself with the statement made by Denmark on behalf of the EU and its 27 countries. Spain welcomes the new strategy, A Healthy Start for a Healthy Life for child and adolescent health and well-being in the WHO European region. We believe that it is a comprehensive approach grounded in equity, participation, and multi-sectoral action. It is essential to create environments where all children and adolescents can fully develop and reach their potential. This vision is fully reflected in Spain's national policies, which place child and adolescent health at the core of our promotion, prevention, and equity strategies. In this regard, the National Strategy for Health Promotion and Prevention, the National Strategy Plan for the Reduction of Childhood Obesity, and the National Strategy on Sexual and Reproductive Health all contribute to advancing the goals included in this European strategy, investing early in health, strengthening equitable and quality care, and ensuring safe and supportive environments for every child and adolescent. To achieve these goals in promoting child and adolescent health, we invest strategically, integrating promotion and prevention across all life stages and addressing the social determinants of health. We deliver comprehensive and equitable care through capacity building for health professionals and coordination with education and social services. We protect children from the commercial determinants of health, including the marketing of unhealthy foods and breast milk substitutes. We foster intersectoral collaboration, as demonstrated by our Health Promoting Schools Network and joint actions with the educational sector to promote healthy lifestyles and emotional well-being. And we strengthen monitoring and accountability through international cooperation and evidence-based policy making using tools such as the Health Behavior in School-Aged Children study. Spain is also proud to be recognized as a front-runner country in the WHO Action Plan on Stop Obesity, reflecting our national commitment to creating healthy environments and reducing health inequalities from early childhood. We will continue to work actively with the WHO, UNICEF, and member states to implement this new regional strategy, convinced that investing in the health and well-being of children and adolescents is the most solid and fair investment for the future of our societies. Thank you.
Thank you very much, Spain. I would like to give the floor to Switzerland, followed by Turkey.
Sehr geehrter Herr Präsident.
President, Switzerland supports the shared statement made by the youth delegates. Switzerland fully supports the following strategy. This broad framework reflects an important element for protecting the health and well-being of the next generation. It recognizes that early intervention is key for health throughout life. This strategy focuses on holistic and scientific approaches, which also take into account social factors in affecting health. Equal opportunities, resilience, and self-determination for children and young people are key. We have a focus on various areas with inclusive policies and engagement of populations, and reflects the global health priorities and the Sustainable Development Agenda. Protecting young people against the results of digitalization is also key. Increasing screen use and social media use is something that needs to be addressed with young people. Switzerland considers that this strategy will significantly help to overcome inequalities, improve health throughout life, and create an environment in which all young people can have a healthy development. Thank you.
And let's pass on to Turkey, followed by Ukraine.
Thank you, Chair. We commend the development of the strategy, which offers a timely, comprehensive and rate-based roadmap to improve the health and well-being of children and adolescents across the region. We strongly support the strategy's focus on equity, mental health, early intervention, and the creation of the health systems that are responsive to unique needs for young people. Investigating in children and adolescents is not only an ethical obligation, but also a foundational pillar for building resilient, inclusive, and future-ready societies. As we move forward to implementation phase, it is vital that we ensure no child is left behind, regardless of geography, status, or circumstances. In this regard, we cannot turn a blind eye to the ongoing humanitarian catastrophe in Gaza, where thousands of the children face the harrowing consequences of conflict, displacement, and the near total collapse of health infrastructure. These children, like all others, have an inherent right to health, protection, and a future. Their suffering must not be overlooked, and their voice must be heard in our collective efforts. As Turkey, we reaffirm our commitment to regional and global cooperation in advancing child and adolescent health. We stand ready to contribute our experience, share good practices, and engage in meaningful partnership to support the effective implementation of this important strategy. Together, we can build a healthier, more equitable future for every child. I thank you.
Thank you very much, Turkey. I'd like to give the floor to Ukraine, followed by Denmark.
Honorable Chair, distinguished delegates, I'm delivering this statement as the Ukrainian Youth Delegate. We thank the WHO Regional Office for Europe for its inclusive and evidence-based approach in developing the strategy and for keeping children and young people at the heart of public health priorities. Focusing on mental health, early childhood development, vaccination, digital well-being, and protection from violence, it addresses the unprecedented health challenges faced by children and adolescents across the region. But allow me to remind you what unprecedented health challenges truly mean for Ukraine. Nearly 700 children have been killed and more than 2,000 injured. 75% of Ukrainian children have been experiencing psychological trauma due to the war. Today, 51 youth centers and spaces have been completely destroyed, and another 70 remain under temporary occupation. Every third child in Ukraine has witnessed someone being killed or injured. Every third. These are statistics, but behind each number stands a child and adolescent with the dreams, fears, hopes for the future. Let me share one story. On the night of the full-scale invasion began, a girl was preparing for her university exam. She went to bed at 3 a.m. and 2 hours later she was woken up by a call. She had 7 minutes to pack her entire life into a small backpack. She spent the following months studying in university shelters, preparing for classes without light, water, or electricity. Today she is a medical resident, and almost every night shift begins with the same way, helping move critically ill patients away from windows during alarms, so they don't gonna be injured by explosions. That girl is me. And this is my personal story. And I consider myself lucky, because many of my peers are no longer alive. Ukrainian children and youth are not the future generation. They are the generation of here and now. We are resilient and unbroken, because we are those who will rebuild our country. We fight and will continue to fight for our future every single day. This is why Ukraine is now developing a national program, Youth of Ukraine, Generation of Resilience 2030. And this is why support of WHO and all member states is more vital than ever. Thank you.
Thank you very much, Ukraine. I'd like to follow up with Denmark in their national capacity, followed up by the United Kingdom.
Thank you, Chair. Honorable Chair, Your Excellencies, distinguished delegates, today I do not speak alone. Today I speak on behalf of the European youth delegates from Denmark, Estonia, Lithuania, Norway, Portugal, Slovenia, Switzerland, and Ukraine, representing more than 11 million young people. And today we look proudly at our European region, because despite the unprecedented financial challenges the organization is facing, we were still able to unite and agree on creating a new and powerful strategy for child and adolescent health, with a focus on mental health, digital health, and children and youth in vulnerable settings. With this strategy, we're not only improving the lives of the young leaders of today and tomorrow, but we're also ensuring healthier lives for more than 1/3 of the people in our region. The focus on youth and adolescents in vulnerable settings is especially relevant today more than ever. The humanitarian crisis in Gaza and the humanitarian crisis in Ukraine reminds us of the profound and long-lasting impact of conflicts on young people's health, safety, and future opportunities. Considering the unprecedented challenges to young people's health and well-being, from studying and working under constant shelling and power outage to supporting refugees and communities affected by these crises. In parallel, the growing effects of climate change create additional pressure on health systems and communities, demanding coordinated, multisectoral responses to protect the most vulnerable. Therefore, creating a strategy is simply not enough. We must ensure strong monitoring, accountability measures, and most importantly, that the strategy will also be implemented at a national level with a strong youth involvement. This should not just be a choice, it's our responsibility. By the endorsement of the strategy, we're proud to see that you, Hans Kluge, our WHO Euro Regional Director, will be mandated to support member states in the implementation of the strategy. And we urge all member states to adopt this strategy in a national setting. We must focus on the topics most relevant to children and adolescents. Therefore, the protection of young people from harmful marketing and media, recognizing their vulnerability to the harmful effects of commercial goods and services, is crucial. We must also protect youth from excessive screen time and unregulated social media use. Building resilience and reducing exposure are essential. And we must guarantee adequate mental health services supporting the 1 in 7 young persons suffering from mental health disorders. Finally, we would like to address that many of us were present at the World Health Assembly in Geneva and in New York at the high-level meeting on non-communicable diseases and mental health at the UN General Assembly. We witnessed how leaders from all over the world got together and almost agreed on a strong and comprehensive political declaration. However, a strong focus on youth and adolescent health was missing. So with this strategy, our region withstands its position as the champion for young people and adolescents. And we need to remember not to take this for granted. This is something that we must keep on fighting for the future generations, for our current generations, and for all of us. Thank you.
Thank you very much, Denmark. Let's give the floor to the United Kingdom, followed by Armenia.
Thank you, Chair. The UK welcomes the strategy on child and adolescent health and well-being. We're pleased to see the strategy's focus on early years, which are crucial to their development, health and life chances, as well as the emphasis on targeting health inequalities. We support the inclusion of mental health alongside physical health and ask for specific consideration for suicide as one of the leading causes of mortality for older adolescents with a clear gendered profile. Finally, we welcome the forward-looking content, recognising the emerging need for ongoing considerations around digital harms and opportunities such as AI. The UK looks forward to working together and in partnership with children and adolescents themselves to ensure that every child has a healthy, happy start to life. Thank you.
Thank you very much, United Kingdom. Let's move on to Armenia, followed by Austria.
Honorable Chair, distinguished Regional Director, Excellencies, colleagues. It's a profound honor to address the topic of paramount importance, securing a healthy start for a healthy life, as envisioned in the WHO European Region's Strategy for Child and Adolescent Health and Well-being for 2026-2030. This strategy is not merely a document. It is a shared commitment, a vital roadmap for nurturing the potential of our future generations across the European region. Armenia firmly embraces the principles outlined in this new WHO strategy. The health and well-being of children and adolescents is recognized as one of the 6 key strategic pillars of the National Healthcare Development Strategy of Armenia. Our efforts have concentrated on improvements and developments designed to ensure every child and adolescent in Armenia not only survives but thrives. Strategic approaches to improve child and adolescent health start with focusing on improving relevant prenatal, intranatal, and postnatal care, especially for vulnerable newborns. Thanks to improvements in our immunization programs and robust public communication efforts, we continue to sustain high routine vaccination coverage. We work toward improving care for development of the children in collaboration with WHO expand rehabilitation programs. One of our key directions is improving care for children with NCDs. As the saying goes, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. The approval of the National Mental Health Strategy and Action Plan, which specifically addresses the needs of children and adolescents, marks a crucial step in ensuring access to quality mental health support from early childhood onwards, recognizing the mental health as a rising global challenge. Our progress has been significantly amplified through our deep and enduring partnership with the WHO. Having at the forefront of this collaborative work with the Institute of Child and Adolescent Health, which serves as a WHO collaborative center on child and adolescent health in Armenia, we consider this partnership pivotal in ensuring evidence-based policy guidance, technical assistance, and access to crucial regional data and comparative insights. Armenia conducts the Health Behavior in School-Aged Children study, allowing us to regularly monitor the health behaviors, well-being, and social environments of our adolescents. To develop evidence-based interventions to promote healthy diets and physical activity, Armenia implements Childhood Obesity Surveillance Initiative Study, COSI. Armenia is committed to strengthening its health system to develop high-quality, comprehensive, and age-appropriate care that our children deserve. We will continue to expand our collaboration with WHO and all partners, leveraging data and best practices to transform the lives of our young people. Let us commit to turning this visionary strategy into a tangible reality, ensuring a genuinely healthy start for every child and adolescent for a robust, prosperous, and healthier Europe and world. I thank you.
Thank you very much, Armenia. Let's follow this up with Austria and then Belgium.
Vielen Dank. Thank you very much. Austria aligns itself with the statement on behalf of the EU. The health of young people helps to set the tone for a healthy population and is the foundation for promoting health and prevention in our society. Healthy development in early years shapes health throughout a person's life, as well as the health of future generations. For this reason, we have to look after the health of our children and young people and do that through policies in all areas. The foundation for healthy development is set in early childhood. For this reason, supporting the social environment around a child, in particular the family, is essential for children and young people and their health. We have to fight inequalities. We have to ensure that people have equal access to healthcare. The meaning of social media, or the significance of social media here, shouldn't be underestimated, in particular its influence on children and young people. That represents a new challenge. This is something that we have to deal with in awareness raising and proper regulation. In developing a strategy, as well as through implementing the measures in this strategy, and in this, participation and involvement of children and young people has to be at the centre of it. There's something else that's central, and that's international cooperation, so that we can achieve our objectives in this area together. A network that goes across national borders can, for example, help to exchange best practices and to learn from the experiences of the WHO on the one hand and its member states on the other. If we have a common strategy for the European region, then we can face new challenges, and we can do that together. And in doing that, we can deal with the essential issues for children and young people and their health. We therefore welcome the adoption of the new strategy for children and young people in the European region. Thank you.
Let's move on with Belgium, followed by Bulgaria.
Thank you, Chair. Belgium aligns with the statement delivered by Denmark on behalf of the EU and its member states. We warmly welcome the new strategy on child and adolescent health and well-being, an age group that deserves special attention, as every child has the right to start its life in good health. We share the concern regarding the decline in mental health outcomes for children and adolescents over the past 25 years. Girls, older adolescents, and adolescents growing up in low-income families are struggling the most. The mental health of children and adolescents is particularly challenged in today's digital era. Our youth are massively exposed to screens and online contents that can harm their health. This can lead to addiction and mental health issues, while they are also exposed to violence, harmful stereotypes, and damaging body image, misinformation, and aggressive marketing for unhealthy products. These problems are not new, but they have reached an overwhelming scale in the digital world. WHO has a key role to play in developing evidence-based guidelines to regulate digital environments for the sake of children's health. Digital media and platforms who design addictive patterns and disseminate harmful contents should be made accountable in the protection of the health and rights of their young users. WHO should drive efforts to better protect children against these commercial determinants of health. The same is true for the commercial determinants of obesity and overweight. 1 in 3 children aged 9 to 5 years old are living with overweight or obesity. This required a comprehensive health in all policies approach. It is imperative to strengthen the regulation of marketing of food high in sugar, salt, and fat that is targeting children, as well as the inappropriate promotion of breast milk substitutes. Besides addressing major risk factors such as poor diet, alcohol, tobacco, vaping also requires determined political action to prevent a new generation of addiction. Industries are targeting youth with fancy design and flavors or with the addition of very addictive substances. This market is expanding very fast, so must be the public health reaction. We believe this issue should be addressed explicitly at the COP/FCTC now in November. Colleagues, public health must be prioritized over other considerations such as economic interests. Especially when it comes to our children, this is a moral duty that binds us all. Thank you.
Thank you very much, Belgium. Let's give the floor to Bulgaria, followed by Estonia.
Honourable Chair, distinguished delegates, Bulgaria aligns itself with the statement delivered on behalf of the EU and its member states. Bulgaria welcomes the new strategy for child and adolescent health and well-being 2026-2030, developed jointly with UNICEF, and considers it a key, timely and comprehensive document. It adequately reflects the contemporary challenges to the health of children and adolescents, such as climate change, deteriorating mental health, and risks in the digital environment. We fully support the vision of the strategy, which is in line with our national priorities for ensuring a healthy and supportive environment for every child. We highly appreciate the involvement of young people in the development of the document, an approach that we share and consider fundamental to the success of any policy in this area. The strategy's alignment with global frameworks such as the Convention on the Rights of the Child, the Sustainable Development Goals, and the WHO European Programme of Work ensures its sustainability and continuity. Bulgaria shares the understanding that investments in children's health are investments in the future of society, particularly with a strong focus on mental health. Given the epidemiological link between the incidence of certain diseases, such as tuberculosis, and poor socioeconomic living conditions, we believe that actions to overcome social inequalities and ensure a healthy living environment for every child are important for reducing the incidence of infections. Furthermore, we welcome actions to provide health services for children and maximise their applicability and accessibility. In conclusion, Bulgaria welcomes its commitment to achieving the goals set out in the draft strategy and is open to active cooperation and to accomplish them. The document provides a solid framework for combining our efforts at national and regional level, with national initiatives and policies remaining the leading force. We support the draft decision to improve the health and well-being of children and adolescents and to reduce the burden of morbidity among children and adolescents through actions to promote and protect health, disease prevention with a particular focus on children and adolescents living in vulnerable environments through a multi-sectoral approach involving education, hygiene, nutrition and social welfare. Thank you very much.
Thank you very much, Bulgaria. I'd like to give the floor to Estonia on their national capacity to speak to us, followed by Kyrgyzstan. You have the floor.
Thank you. Honorable Chair, Regional Director, distinguished colleagues. Estonia aligns itself with the statements delivered by the European Union and its member states, Scandinavian Baltic countries, and the European youth delegates. We welcome this inclusive and forward-looking strategy. It provides a strong foundation for ensuring that every child in our region has a healthy start for a healthy life. We particularly welcome the emphasis on strategic investments. For Estonia, strengthening primary health care to monitor and support the health development of children and young people has been a key priority. At the same time, developing comprehensive, equitable and high-quality specialized care remains essential. Together, these efforts have brought measurable benefits. Our child mortality rate has decreased by 88%, and infant mortality rate about 6 times over the past 30 years. This reflects the impact of long-term and consistent action. However, new times bring new challenges. We therefore appreciate that the strategy also addresses the harmful impact of commercial products on children's health. Marketing of unhealthy food, alcohol, and nicotine products continues to influence young people's choices and well-being. Estonia looks to WHO for continued evidence-based guidance and arguments to support member states in developing effective regulatory measures in NCD prevention. We highly value the role of regional networks that facilitate cross-border cooperation and knowledge sharing. In this regard, we emphasize the importance of continuing the EVID Action initiative beyond 2026. Now, speaking as a WHO youth delegate on behalf of the youth of Estonia, we stress the need to focus on the mental health of children and adolescents. For our generation, mental health is one of the biggest health challenges. Amid crisis on multiple fronts, our mental resilience has constantly been tested. Effectively addressing this requires a systematic approach, from low-threshold early interventions to specialized care. Moreover, children and young people must be part of the solutions themselves. Only through meaningful participation can we create approaches that are truly fit for purpose, as highlighted by the motto, nothing about us without us. Thank you.
Thank you very much, Estonia. I would like to give the floor to our last member state on the list, Kyrgyzstan. You have the floor.
Спасибо большое.
Thank you very much. Kyrgyzstan is pleased to welcome the new strategy on health and welfare of children and adolescents in the European region, as prepared by the WHO and UNICEF. Kyrgyzstan places the health of children and adolescents as one of its priorities for the development of the country. The country is working through a plan to reduce mortality and morbidity among children. Child mortality is reducing every year, but there is still a great deal of room for improvement. We have particular concerns about deaths among adolescents. The indicator here is increasing and has been over the last 4 years. But it's also, and that's been the case in Europe, but in Kyrgyzstan it's remained stable among adolescents between 10 and 19 years old. Nonetheless, we think that the first 1,000 days of life among our children and newborns are the most important. They set the tone for the rest of a person's life, both in terms of their physical and mental health. I'm proud to say that Kyrgyzstan has had good indicators on breastfeeding in the first days of life, which is where we are higher than the European average. One of our main healthcare priorities is prevention of non-communicable diseases. Kyrgyzstan also thinks that prevention of non-communicable diseases among children and adolescents is very important. As part of the most important 4 interventions that we can make, Kyrgyzstan particularly attaches importance to physical activity among children and adolescents and increasing it, as well as among the population generally. There's been an initiative and support from the president of the country, and as a result we're actively building sports centres, stadia, and we've also looked at building the largest alpine and ski resort in the region. We're also pleased to note that all of the countries in the European region are devoting attention in particular to an intersectoral approach in fighting the commercial determinants of health, those such as tobacco, alcohol, sugary foods, trans fats and salt. Kyrgyzstan has made significant progress in fighting smoking and alcohol use among younger people, which is important throughout the European region, but at the same time we need to make further efforts to reduce the accessibility of, both in financial and physical terms, of harmful products such as tobacco, alcohol and sugary foods, as well as others. We need to further regulate the aggressive marketing of harmful products. Kyrgyzstan has fully banned advertising for tobacco and alcohol, but nonetheless they're still advertising for other unhealthy products. Kyrgyzstan is also working on increasing pay for our medical professionals, but still we have a severe shortage in our specialists. We think that we need to deal with this issue among the lack of health care professionals, which is an issue in our country but also throughout the region and the world. On the whole, the Kyrgyz Republic supports the strategy as proposed, and we think that the adoption of it comes at the right time, in particular given the slowing in the birth rate and also other issues. Thank you very much.
Thank you very much, Kyrgyzstan. This concludes the round of the member states. I don't see any other raised nameplates, so I'll propose that we move on for statements from our UN agencies and other international organizations. For efficiency measures, this year we piloted a pre-established list of speakers, so we will go through them the way they appear here on my list. So please let's start with the United Nations Population Fund.
Excellencies, distinguished delegates, partners, and colleagues. My name is Evgenia Usichenko, and I'm honored to address you today as a youth delegate representing Teenergizer, a youth-led organization dedicated to empowering young people across Eastern Europe and Central Asia, supported by our long-standing partner, UNFPA. We provide peer-to-peer psychological and psychosocial support and build safe digital space for adolescents in need, care without stigma, peer support that youth trust. I stand today at the 75th Regional Committee celebrating the launch of the Strategy for Child and Adolescent Health and Wellbeing in the WHO European region, visioning that every young person realizes their right to physical, mental, and social health, a vital, non-negotiable step forward. The extensive youth consultations that informed that strategy were crystal clear about our key issues of concern: the overwhelming burden of mental health, the risks of excessive screen time, a problematic social media use, and the barriers to access health services. A healthy start for a healthy life arrives at the most defining moment in time when across our region, adolescents and youth face widening inequalities in access to mental health, sexual and reproductive health, and social support, worsened by war, conflict, displacement, and economic strain, monthly, weekly, and daily. Too often, young people fall between the systems, too old for child services, too young for adult care. What is the result? Suicide is one of the top 3 leading causes of death among adolescents in our region. We simply cannot afford silence any longer. The new strategy gives us hope for a pathway for real change. However, for this strategy to succeed, your commitment must move from paper to targeted investment and regulatory action. We urge all member states to strategically invest in child and adolescent health and well-being for long-term benefits. Our call to action is fourfold. Mandate peer support, integrate and fully fund youth-led peer-to-peer mental health programs like the Teenergizer model, like many other successful youth-led models out there within school and primary care systems as a standard accessible service delivery mechanism. Abolish legal barriers, commit to aligning all national legislation with the UNCRC to guarantee adolescents independent, confidential access to health services, particularly for mental and sexual health, without mandatory parental consent. Ensure comprehensive sexuality education, fulfill the commitment to immediately integrate right-based, age-appropriate, and evidence-informed TCC into all national schools, curricula, and youth programming to equip adolescents with the skills for healthy relationships and responsible choices. Invest in youth-led governance. Listen to our experience, invest in our solutions. Let us move forward, not just for us, but with us. Thank you.
Thank you very much. The next one on the list would be the Northern Dimension Partnership in Public Health and Social Wellbeing Secretariat. Please, you have the floor.
Thank you, Chair. Children's and adolescents' mental health and well-being are increasingly vulnerable due to rising pressures from digital and social environments, climate anxiety, commercial influences on health, and unequal access to mental health care. A life course approach is vital. Early health shapes adult well-being. In this context, schools play a vital role. They are where young people spend most of their time learning, playing, making friends, and developing the sense of self. That's why the NDPHS, along with our partners in the School Changer project led by Poland, is creating a model of cooperation between teachers, school managers, students, with the aim to redesign school environments to better support students' mental health and overall well-being. Our research has shown something important. Many students feel unseen when it comes to choices that directly impact their well-being. By involving students in these decisions, we not only promote healthy behaviors, but also foster a culture of engagement and shared responsibility. Giving young people a voice in shaping their environment helps them grow into active, confident members of their communities, developing valuable skills such as problem-solving, teamwork, leadership, and most importantly, self-care. We welcome the strategy. With our unique position as a regional platform, bringing together various sectors, the NDPHS is exceptionally well placed to contribute to the strategy, fostering effective cross-sector collaboration, ensuring that expertise and action are aligned across policy areas for greater impact in promoting the best possible start in life. Thank you.
Thank you very much. We see a name tag raised. I would like to give the floor to the Council of Europe, if I see that right from here.
That's right, thank you. Thank you, Mr. President. The protection of health of children and young people is a priority for the Council of Europe. This includes promoting their health literacy and access to healthcare. To support children, families and health professionals, the Council has recently produced a guide to children's participation in decisions about their health, which focuses on their best interests by supporting children and parents with appropriate information, supporting children in expressing views and formulating opinions, taking into account children's opinions, reaching the best possible health decisions. In the framework of the work of the Council of Europe on Human Rights and Biomedicine, new guidance is to come and will address exposure to targeted advertising, misinformation, and harmful content impacting their mental and physical health. And it will also explore and develop human rights implications, or look at those implications of social media use and AI applications. So, to conclude, our cooperation together on children and young people's physical and mental health would be an important next step. Thank you.
Thank you very much. I don't see any other raised name plates, so I would suggest that we move on to the non-state actors, and the ones first on the list to come up here is the Your Health Net, if you're available.
Dear Regional Director, Chair, distinguished delegates, we welcome the WHO European Strategy for Child and Adolescent Health and Wellbeing and commend its clear and actionable framework. This strategy comes at a vital moment. And to support effective implementation, EuroHealthNet and its 13 co-signatories propose 3 key priorities. First, to put social inequalities in health at the core. Ministries of health can lead by embedding equity as a guiding principle. This means equity-oriented budgets, universal access to health promotion and prevention alongside treatment and care, and monitoring progress across all groups, including children and young people with disabilities, from low-income families and those harder to reach, so that resources follow need. Second, to strengthen protection from harmful commercial determinants. Ministries of health should champion stronger regulation of marketing and advertising of tobacco, novel nicotine products, alcohol and unhealthy food, and especially ultra-processed foods, online and offline. We must promote evidence-based decision-making, protected from commercial influence and conflicts of interest. Laws must also safeguard children from harmful physical environments, including exposure to air pollution, noise, lack of green spaces, and climate-related health risks. These efforts need cross-sector coordination and effective local enforcement. Third, to scale up the health-promoting schools model. This evidence-based approach builds healthy, inclusive and equitable learning environments. And by focusing on the physical and social conditions that shape health, such as supportive school cultures, safe and active mobility, clean air, and stronger links with community-based primary care, this model lays a strong foundation for well-being in schools. It extends beyond classrooms. It's about mobilizing schools, families, communities, and policymakers, especially in health and education, around a shared vision. And the European Health Promoting Schools Network should be revitalized as a concrete measure to implement the strategy. Every child and adolescent in the WHO European region has the right to grow, learn and thrive in safe, healthy places. And using this strategy as our guide, EuroHealthNet and co-signatories are keen to work with WHO and member states to help deliver measurable progress for Europe's next generation. Thank you.
Thank you very much. I would like to give the floor now to the International Federation of Medical Students Association. Followed then by the European Heart Network and European Stroke Organization. So you can prepare. Thank you.
Honorable Chair, Regional Director, distinguished delegates. My name is Martyna, and I'm speaking today on behalf of the International Federation of Medical Students Associations, representing 1.5 million medical students from over 130 countries, including 48 within the WHO European region, and on behalf of our co-signatories. As representatives of youth and future healthcare professionals, IFMSA warmly welcomes the development of a strategy for child and adolescent health and well-being. For us, the strategy is a roadmap, a commitment, and a collective promise to our generation and to those who will follow. Children and young people know their realities best, yet health systems, including medical education, too often fail to meet their specific needs. Their health is shaped not only by medical care, but also by social, economic, and environmental factors. Mental health and climate impacts remain largely overlooked, even though nearly half of the mental health conditions begin in adolescence, and 88% of climate-related health losses affect children under 5. Therefore, involving those directly affected in policymaking is crucial to ensure their needs are truly addressed. In the European region, nearly 16% of the population are under 16. Yet, youth representation in decision-making remains minimal. Only 12 of 53 member states included a youth delegate at the 78th World Health Assembly, and even fewer children are represented. Therefore, we call on WHO Europe to establish a regional youth advisory mechanism to support implementation of the strategy and ensure accountability to young people, health ministries and academia to integrate intersectional child and adolescent health into medical and health professional education. Member states to ensure systemic integration of comprehensive mental health, climate-resilient health services, and preventive care into primary healthcare packages, realizing a holistic and integrated approach to child and adolescent health under universal health coverage. Member states to ensure meaningful youth participation in the design, monitoring, and evaluation of all health policies and services, including the implementation and funding of youth delegate programmes within relevant UN and WHO bodies. In this unique opportunity to speak for young people, we urge you to remember, empowered children and youth are not just recipients of change, but drivers of it. The choices made here today will shape our future, our children's future, and the future of our patients. Thank you.
Thank you very much. The next one on the list would be the European Heart Network, European Stroke Organization, followed by the European ME Alliance. And may I kindly remind the following speakers to keep to the time allocated to them. Thank you.
Thank you very much, dear Honourable Chair, esteemed Director and delegates. The European Heart Network and the European Stroke Organization support the World Health Organization's Europe's vision to promote health and well-being at all stages of life. Cardiovascular disease and stroke remain Europe's leading cause of death and disability, yet most are preventable. EHN and ESO call for a coordinated, equitable life course approach to cardiovascular and brain health, aligned with WHO strategies on child and adolescent health and healthy aging. A healthy start. Children and adolescents, like everybody else, should have the right to live in health-enhancing and sustainable environments. This implies access to healthy, affordable food, living in smoke-free environments, access to clean air, and the possibility to live active lives whilst allowing mental well-being. Endures systematic age-neutral emergency and primary care protocols requiring basic screening for hypertension, cholesterol, diabetes, and atrial fibrillation. Tackle social and economic inequalities so every child can grow up healthy. Healthy aging, prevention, early detection and integrated care for CVD and stroke. Strengthen an understanding of sex and gender-specific aspects of cardiovascular and brain health, improving diagnosis, treatment and outcomes for women. Create age-friendly, inclusive environments that value older people's contributions and combat isolation. Targets for 2030. EHN aims to reduce mortality from premature CVD by 30% by 2030. Together with ESO, we call on European and national leaders to cut stroke by 15% and ensure 90% of patients are treated in dedicated stroke units. A call for equity and action. Make equity central to all CVD and stroke policies. Strengthen tobacco, alcohol and nutrition regulation. Fund interoperable data systems to track outcomes and inequalities. ESO and EHN stand ready for you to support you in your endeavors. Thank you.
Thank you very much. The next one on the list would be European ME Alliance, as discussed, followed by the European Respiratory Society.
Yes. Honorable Chair, esteemed delegates, it's heartbreaking but true. Children with myalgic encephalomyelitis, abbreviated ME and sometimes referred to as MECFS, face relentless fatigue, severe pain, brain fog, and the main symptom of post-exertional malaise. That means that even minimal physical, mental, or emotional exertion can make their bodies and energy levels crash, and their ability to function unpredictable. They miss years of education, friends, and critical moments in their development. Families are left struggling, giving up jobs to care for sick children, causing financial hardship and creating generational poverty. Because the illness is misunderstood, some parents are wrongly accused of child neglect or abuse. Children have been removed from their homes and placed in foster care or psychiatric units and coerced to use harmful therapies, causing them enormous trauma and irreparable harm to their health. This exposes a critical gap in child and adolescent health systems, one the WHO strategy must urgently fix. We call on WHO and its member states to ensure early recognition, home-based care, tailored education, family-centered support, and legal protection for children and adolescents with ME. By addressing ME early, WHO Europe would not just protect children today. It would reduce the burden of lifelong disability tomorrow and truly deliver on the promise of healthy aging and well-being for all at all ages. Thank you.
Thank you very much. Next one, I would like to pass the floor to the European Respiratory Society, followed by the European Cancer Organization.
Dear Chair, Regional Director, distinguished delegates, the European Respiratory Society strongly supports the focus on child health and emphasizes that environmental degradation and climate change pose growing threats to children's respiratory health. Early life exposure to air pollution and climate-related hazards can have lifelong consequences on lung development and well-being. Despite recent improvements in European region, still over 96% of children breathe air that is harmful to their health, as concluded by newest WHO air quality guideline from 2021. Exposure to air pollution in early life harms and impairs healthy development of lung function and weakens immune systems, leading to increased risk of asthma and acute lower respiratory infections throughout childhood and adolescence, posing burden to children and their caretakers. In February 2013, 9-year-old girl Ella Debrakisi, a severe asthma patient who lived on a busy street in London, died as a result of an air pollution-triggered asthma attack. Air pollution was declared as the primary cause of Ella's death in a historical court ruling, reminding that air pollution poses a grave risk factor to health children, and that can be even fatal for those that are most vulnerable and most sick. Furthermore, climate change is presenting new challenges in terms of air pollution from wildfires, dust and sandstorms, increased ozone exposure in the cities due to global warming, that alone and in combination with exposure to increasing heat waves, new aeroallergens and new infectious agents will affect children's health negatively. In conclusion, European Respiratory Society calls for joint air pollution and climate mitigation action as an essential part of the strategy for healthy start of life and child and adolescent health and well-being. Let's work together towards the future with clean and safe environments for children to play in, learn and thrive, and where no child will get sick or die from breathing. Thank you.
Thank you very much. The next one is the European Cancer Organization, followed by Eurocam.
Dear delegates, colleagues, the European Cancer Organization and the Undersigned Organization, on behalf of the European Health Alliance on Alcohol, commend the WHO Europe's leadership in addressing alcohol-related harm and welcome the implementation of the European Framework on Alcohol. Alcohol consumption remains a major threat to young people's health and development across the WHO European region. The region continues to record the highest level of alcohol use globally, with worrying trends among adolescents and young adults. More than half of adolescents aged 15-19 in the region have already consumed alcohol, and nearly 14% of them report episodes of alcoholic drinking. Among young adults aged 20-24, alcohol is responsible for nearly 40% of all deaths in this age group, largely through injuries, violence, and road accidents. Alcohol marketing, low prices, and wide availability continue to normalize drinking behavior, undermining prevention among youth. Therefore, we urge the Regional Committee to extend and strengthen the European Framework for Action on Alcohol to 2030, ensuring alignment with the WHO Global Action Plan on Alcohol and sustained political commitment. Integrate alcohol control into cancer and non-communicable disease prevention strategy, explicitly recognizing alcohol as a major preventable cause of cancer and other chronic disease. And accelerate implementation of WHO recommended measures, including higher taxation, minimum pricing, comprehensive bans on advertising and sponsorship, clear labeling, and stronger monitoring to protect young people and vulnerable population. Thank you.
Thank you very much. I'd like to give the floor to Eurocam, followed by the European Federation of Allergy and Airways Disease Patients Association.
Bonjour. Good morning. My name is Louisa. I'm 11 years old and I'm a youth delegate of the Federation Eurocam. Eurocam represents patients, practitioners and veterinaries in Europe who want both modern medicine and traditional medicine and complementary medicine to be part of healthcare. This would allow us to each receive the care that we need while recognizing our individuality. For me, being in good health allows me to live well, to play with my friends, to learn new things every day, to go to school, and to make my dreams come true. Health is a responsibility of all of us, children and adolescents, as well as adults, because adults are the ones who make important decisions for us every day about what we eat, what we drink, the air we breathe, but they also choose the type of care we are to receive. Today, you are talking about a draft project for health and well-being of children and young people in Europe. What I like about this project is that it takes into account our health in a holistic manner. Our emotions, our mental health, our bodies, our diet, but also the time we spend in front of screens and the influence that advertisements for products which can be damaging to our health has on us. A few months ago, last May, countries around the world adopted a strategy for traditional medicine. Recognizing this strategy, your project will allow for healthcare to be put into place which respects each of us in our abundance, in our choices, in our cultures. We, children, are the future of this world. We want to grow up to be healthy adults, and that work begins now and today. Thank you.
Merci beaucoup pour cette intervention intéressante et le courage de parler ici au Régional.
Thank you very much for having the courage to speak to us here at the Regional Committee.
On the list is the European Federation of Allergy and Airways Disease Patients Association, followed by the International Diabetes Federation.
Thank you, Chair. In May 2025, the World Health Assembly adopted two separate resolutions addressing lung health and skin diseases as key public health priorities. Both resolutions prompt action for countries and regions to develop plans dedicated to lung and skin health. The European Federation of Allergy and Airways Diseases Patients Associations and the co-signatory organizations welcome the WHO strategy for child and adolescent health. We are absolutely confident that the lung health and skin diseases resolutions can serve as key building blocks in making this strategy a reality. Asthma and atopic dermatitis are two of the most common NCDs globally, as they develop during childhood and often persist into adulthood. Children and adolescents are therefore disproportionately affected, including for comorbidities such as food allergy and respiratory allergy, obesity, and cardiovascular disease. Asthma and atopic eczema bear significant impact also beyond physical health, mental, emotional, and social burden arising from stigmatization, bullying and self-exclusion, abstention from activities and sports, and educational gaps due to school absenteeism, and all of this in such a sensitive age. So we call the committee to address commercial determinants such as tobacco and related novel products, including advertisement and product placement targeting young people, and ensure 100% smoke-free environments in areas frequented by children and young people. At the same time, to lead the fight against environmental risks such as outdoor and indoor air pollution, both in homes and schools, and tackle climate change-driven hazards, including heat and urban health allergens. Also to enable better care and treatment for young people via early diagnosis, tailored advice, preventative treatments, and appropriate follow-ups, including comorbidities. In addition, to recognize and tackle the mental and emotional impact and prioritize the easing of the family burden and counteract the social burden of asthma and atopic eczema. And finally, to actively support engagement and participation of young parents or of young patients, enable young people to have a voice and harnessing digital means to reach out to them. The IFA community and the co-signatory organizations are ready to support implementation of the regional strategy to every step. Thank you very much for their attention.
Thank you very much. I would like to give the floor to the International Diabetes Federation Europe, followed by Movendi International, our last intervention.
Thank you. Chair, distinguished delegates, the International Diabetes Federation Europe, representing the voice of people living with diabetes, supports the strategy for child and adolescent health and well-being. Across our region, type 2 diabetes is increasingly diagnosed among children, adolescents, and young adults, driven in part due to rising rates of overweight and obesity. This worrying trend reflects the environment in which children grow, shaped by harmful commercial marketing, limited access to nutritious and healthier food, and conditions for physical activity. Addressing these structural factors require coordinating action and investment to ensure every child has a healthy start and can avoid developing chronic conditions later in life. Early onset type 2 diabetes greatly increases the risk of premature cardiovascular disease, kidney failure, and vision loss, often developing more aggressively than in adults. It also leads to longer lifetime exposure to high blood glucose, causing earlier complications. In addition, young people living with type 2 diabetes often experience stigma, which can worsen management and outcomes. To ensure that all children and adolescents, including those living with diabetes, can live healthy and full lives, we call for strong action on commercial determinants of health, including stricter regulation of the marketing of unhealthy foods and drinks to children. Health-promoting schools and community settings that empower children and adolescents to adopt and maintain healthy behaviors throughout their life course, and equitable access to education, medicines, multidisciplinary care teams, and psychological support tailored to the needs of children and adolescents living with diabetes, whether facing the stigma linked to overweight and type 2 diabetes or the relentless psychological burden of managing the condition around the clock. Thank you.
Thank you very much. Let us now give the floor to Movendi International.
Thank you, President. Excellencies, Movendi International strongly supports this joint WHO Europe UNICEF strategy. We commend its recognition of governments' human rights obligation to protect children and adolescents from preventable harms. We appreciate the evidence-based focus of multiple areas, for instance, priority area 3, that recommends alcohol policy action to protect children and youth from alcohol harms. Unfortunately, we identified one serious gap. Priority Area 2 should explicitly address the needs of children growing up with parental alcohol use disorder or addiction. Rough estimates show that 10% of all children, over 20 million children, live in affected families in our region. They face greater risks of neglect, violence, mental and physical health conditions, and poorer educational outcomes. My family too has been affected. We also call for making a stronger link between fiscal policy and child health. For example, raising alcohol excise taxes reduces the affordability of ultra-cheap products targeting youth and has the potential to fund health and social services for children in need. In true social participation spirit, Movendi members are ready to collaborate with WHO Europe and UNICEF to share evidence and local best practices, expose predatory practices of the alcohol industry, and advance research on key topics of child health and adolescent health to contribute to the successful implementation of this strategy. Thank you.
Thank you very much. This concludes this round of interventions, and I would like swiftly give the floor to Dr. Azzopardi Muscat and later on to the RD to provide any responses. Natasha, you have the floor.
Thank you very much, Chair. And let me start by thanking all member states, partners and non-state actors for your strong support and your constructive engagement. Your passionate interventions today really give us the courage and commitment to go forward. We appreciate the widespread recognition and support for the inclusive consultative process, and we really here built on the wisdom of all the people who contributed, including the direct involvement of the young people and UNICEF. You have acknowledged that we have done our best to work with a strong evidence base. Let me pick out a few topics that I want to re-emphasize because I think they have emerged loudly and clearly. Your focus on equity, inclusion, and children in vulnerable situations. The clear call to make mental health, resilience and social connection a priority. And when we had surveyed all member states a year ago, this was the top polling issue of concern. I remind you that we published a policy brief on the digital determinants and the impact of social media, and we are in the process of updating it, and we will come back to you since we intend to organize an online update and policy dialogue soon. We have heard also crucially that for many of you promoting sexual and reproductive health and rights is a priority, and we will of course also be working closely with UNFPA in this regard. We had a meeting yesterday already outlining how we will go forward. The emphasis on commercial determinants of health was very clear, and the multi-sectoral approach, including health-promoting schools. Many of you also referred to children affected by crisis and displacement and the need for continued solidarity. I was very pleased also to hear from our youth delegates that children and adolescents, you are the drivers for change and you are behind us and beside us. And particularly, I think we were very, very much enthused by the statement that through this strategy, our region is being seen as a leader and champion for the well-being of children and young people. So we are really very, very grateful for all the support, and we commit to continue working hand in hand with you in a fully consultative and participatory manner. Thank you.
Thank you very much, Natasha. I would like to pass the floor to our regional director.
Thank you, Chair. I would like to express my sincere appreciation for everyone who intervened, in particularly so many voices from the youth. I want to thank the member states, the heads of delegations, all of those who have included a youth representative in the delegations, and to further appeal to our esteemed member states to increase the number of countries. I see already quite an increase if we look from 5 years ago, but I agree with one of our youth members that we have to go even beyond. Thank you again to you, dear Regina, from UNICEF, and also our colleagues from UNFPA, all UN agencies and our partners. And I thought also to fine-tune a little bit one point I heard when interacting particularly with our esteemed partners from the non-state actors and NGOs and civil society on the NCD management, which remains very important. So maybe I have to rephrase it a bit. It's about doing different with less. What does it mean? That in our view, the challenge is not the knowledge, it's the system. We know how to prevent and manage hypertension and diabetes, but we face the shortages of the trained staff, and the weak outreach to those who stay outside of the system. So that's why doing different with less means integrating the disease management into the primary healthcare to close those gaps. And that's exactly why in the EPW2 we will further strengthen our work on primary healthcare to do better on the NCD management. And I believe it's the second year in a row that the Regional Committee is taking place during the World Stroke Day as well, which I think is also very symbolically. Thank you. And aussi mes félicitations pour la jeune fille.
Also, congratulations to the young girl from Eurocam. Very well done.
Thank you very much, Natasha, Regional Director. This concludes now the agenda item, and I think we are now ready to consider the proposed draft decision contained in document EUR/RC75/conf/3 on a healthy start for a healthy life, a strategy for child and adolescent health and well-being in the WHO region 2026-2030 and its related costing. Is the committee willing to adopt the proposed draft decision by consensus? I see no objection. The decision is therefore adopted. Thank you very much.